The harsh reality of smoking. In a recent systematic review published in the prestigious journal CA, a cancer journal for clinicians, researchers uncovered compelling evidence linking smoking to a significant increase in the likelihood of developing lung cancer, shockingly, even after quitting smoking. The risk remains elevated for many years. That's what we're going to discuss in this video. As you know, tobacco use, particularly cigarette smoking, stands as a leading preventable cause of cancer and cancer-related disease and cardiovascular disease and dementia, so on and so forth. A study from 2021 revealed that among individuals newly diagnosed with lung cancer, 84% of women and 90% of men were either current or former smokers. As I said, this systematic review, including 22 studies focusing on lung cancer outcomes among adults with over 15 years of smoking history, found that quitting smoking led to a reduction in the risk of lung cancer-related outcomes compared to continuous smoking. However, and that's the important point, the review found that the risk of lung cancer persists even beyond 15 years of smoking cessation, with a significantly elevated risk compared to individuals who never smoked, lasting for 2 to 3 decades. Beyond 15 to 20 years of smoking quitting, the risk of lung cancer mortality remains nearly 5 times, yes, 5 times higher, while the rates of lung cancer incidence remains elevated by 10 to 13 times. Yes, by 10 to 13 times. Even after surpassing 30 years of smoking cessation, individuals who formerly smoked still face significantly increased risk of both lung cancer incidence and mortality compared to those who never smoked. In summary, recognizing the genomic alteration caused by tobacco smoking may not revert over time, the results of this systematic review serves as a cautionary message to current intermittent smokers, challenging the common assumption that quitting smoking eliminates the risk of lung cancer, especially with time passing. The rationale for this shift is explained as follows. While the individual risk of lung cancer does decrease over time after quitting smoking, this reduction is relatively modest when compared to someone who continues smoking. Even after 20 or 30 years since quitting, the risk of lung cancer remains 3 times higher compared to someone who never smoked. In summary, it is crucial to emphasize to all your relatives and friends that harmful effects of smoking and to discourage its initiation while encouraging cessation as soon as possible. Screening for lung cancer using low-dose computed tomography has proven effective in reducing mortality, with current guidelines consistently recommending annual screening for high-risk groups. And this is everything from today. Hopefully this is important information for you and your friends and your patients if you're a doctor. This is Longevity Now FL. I'm Luigi Fontana, Professor of Medicine, the Leonard P. Ullman Chair in Translational Metabolic Health, Scientific Director of Charles Perkins Center RPA Clinic and Health for Life program of the University of Sydney, and a clinical academic in the Department of Endocrinology at the Royal Prince Alfred Hospital in Sydney.